The shoulder is the most mobile major joint in your body. You can reach overhead, behind your back, across your chest, and out to the side. But that freedom comes with a trade-off. Some of the structures that make shoulder movement possible have to glide through a very narrow space. When that space becomes crowded or irritated, people often hear the phrase shoulder impingement. This video is for general education only. It is not medical advice, and it cannot tell you why your shoulder hurts. Shoulder pain can come from many structures, so a qualified clinician is the right person to evaluate symptoms. To understand impingement, start with the shoulder's basic design. The top of the upper arm bone is the humeral head. It sits against a shallow socket on the shoulder blade called the glenoid. This ball and socket setup gives the arm a huge range of motion, but the socket is shallow, so the shoulder needs help staying centered. That help comes from the rotator cuff. The rotator cuff is not one muscle. It is a group of 4 muscles and their tendons: supraspinatus, infraspinatus, teres minor, and subscapularis. Together, they act like a dynamic steering system. They compress and guide the humeral head so it stays centered, while larger muscles, like the deltoid, lift the arm. Imagine the humeral head as a ball that wants to ride upward when the deltoid pulls. The rotator cuff helps keep that ball from sliding too high. It does not just create rotation, it stabilizes. Without that centering action, the top of the humerus can move closer to the bony roof above it. That roof is called the acromion, a part of the shoulder blade. Under it is the subacromial space. This space contains the rotator cuff tendons and a small fluid-filled cushion called the bursa. In normal movement, these tissues slide under the acromion as the arm lifts. The movement should be smooth, like a cable passing through a guide. But if the tissues swell, if the bursa becomes irritated, if the tendon is overloaded, if the humeral head rides upward, or if the shape of the acromion reduces the available room, that smooth glide can become a pinch. Impingement simply means that structures are rubbing or being compressed where they need room to move. One of the most commonly discussed areas is the supraspinatus tendon. It travels from the top of the scapula, passes under the acromion, and attaches to the top of the humerus. Because of that path, it can be vulnerable when the arm lifts and the subacromial space narrows. The bursa in that same region can also become irritated, which makes the space feel even more crowded. A simple analogy is a rope moving through a tunnel. If the tunnel is wide and the rope is smooth, everything glides. If the rope becomes swollen or the tunnel roof dips lower, the rope rubs. The shoulder is more complex than a rope and tunnel, but the idea helps. Impingement is often about the relationship between tissue size, tissue motion, and available space.
There are several ways this crowding can happen. One is soft tissue irritation, like tendinitis or bursitis, where the tendon or bursa takes up more room. Another is structural narrowing, such as a hooked acromion or bone spurs. A third is movement control. If the rotator cuff and shoulder blade muscles do not coordinate well, the humeral head and scapula may not position the space as cleanly during overhead motion. The shoulder blade is a major part of the story. When you raise your arm, the scapula should rotate, tilt, and glide along the ribcage. This is sometimes called scapulohumeral rhythm. If the shoulder blade does not move well, the roof over the rotator cuff may not clear the same way. That can make overhead motion feel more crowded. Many people with impingement-type symptoms notice discomfort when lifting the arm, reaching overhead, or lowering the arm from an elevated position. Some describe pain near the front or side of the shoulder. But these symptoms are not unique. Rotator cuff tears, arthritis, nerve irritation, and other conditions can overlap, which is why this video stays with the mechanics rather than trying to diagnose. A key point: impingement is not always just one structure being pinched by one bone. Research and clinical discussion describe multiple forms and contributing factors. Some cases are more structural, some are more functional. Some involve tendon changes, bursa irritation, muscle coordination, or combinations of all of these. The shoulder is a system, not a single part. That system view helps us avoid oversimplifying. The acromion forms the roof, the humeral head forms the moving ball, the rotator cuff guides and stabilizes, the bursa reduces friction, the scapula changes the roof's position as the arm moves. When these pieces coordinate, the shoulder can move beautifully. When space, tissue condition, or timing changes, the glide can become irritated. So let's recap. Shoulder impingement describes a crowding or pinching problem in the shoulder, often involving the rotator cuff tendons and bursa near the acromion. The rotator cuff is a four-muscle stabilizing system, not just a set of arm rotators. The subacromial space changes as the arm lifts. The scapula matters because it helps position the bony roof. And shoulder pain should never be reduced to a single animation because real symptoms can come from many different tissues. The shoulder's magic is that it trades stability for mobility, then uses muscles and timing to win some of that stability back. Impingement is what can happen when that delicate moving space becomes too crowded. Understanding the mechanics does not replace medical evaluation, but it can make the shoulder feel less mysterious. If you want more calm 3D explanations of joints, muscles, posture, and body mechanics, subscribe and follow along.
Before the final recap, let's walk through shoulder impingement one more time using a transparent 3D shoulder. Imagine the arm lifting out to the side. The ball of the upper arm bone rotates inside the shallow socket, but the shoulder blade also has to rotate upward and backward. These two movements are supposed to work together like a camera gimbal, keeping the moving parts centered as the arm rises. Now look at the small tunnel under the acromion, the bony roof at the top of the shoulder. Passing through that space are soft tissues, such as rotator cuff tendons, and a fluid-filled bursa. If the arm bone rides too high, if the shoulder blade does not rotate well, or if the tissues are already irritated and swollen, that tunnel can feel crowded. This is why shoulder impingement is often better understood as a movement problem plus a tissue irritation problem, rather than a single part being permanently pinched. The same overhead motion can feel fine on one day and uncomfortable on another, depending on fatigue, posture, repetition, and how irritated the tissues are. In the animation, watch the difference between a centered shoulder and a shoulder that drifts upward. When the rotator cuff helps hold the ball centered, the larger deltoid muscle can lift the arm more smoothly. When that balance is off, the top of the shoulder may become a place where friction and pressure build up. The main lesson is simple. The shoulder is not only a ball and socket joint. It is a coordinated system involving the arm bone, shoulder blade, collarbone, tendons, and muscles. When that system loses timing or space, overhead motion can become uncomfortable.